have two teeth which is prepped for veneer on the model. Tooth number 1-1, tooth number 2-1. You can see the height of tooth number 1-1 and 2-1 is same as lateral. That will not be there in the case of patient. So with the veneer, I'm going to increase the height. Is it very clear? Yeah. So how do I check? For example, when I take the sizing guide, I keep it like this. Overlap over the gingival line of the tooth. And see, now this is medium. Medium is too big. Can you see that? So now I go back to small and I'm going to check with my small. Now small is almost absolutely correct. Can all of you see that? Sometimes what will happen, the medium will be a little big, the small will be a little too small. So that's when you have to adjust, okay? So you can get a veneer which is in between small and medium. So you take a medium and reduce the size, which I will show you in some time, okay? So this is how you measure the size. You can do directly on the patient's mouth, okay? You can autoclave it, use it for the next patient. Or if you're working on the model, you can do it on the model. That's up to you, huh? Okay, after that, you have a bib there, which you can use it. I'll use this to get good contrast. Yeah. Okay. And then you have a bonding well. All of you have the bonding well. One A is for veneer bond, B is for bond of the tooth. So don't confuse. There are two bonds you will use here for this procedure. One is veneer bond for the veneer and regular bond for on the tooth. Okay. You have a finishing strip. In the finishing strip, you see one side is medium, the other side is fine. Just you can feel it, okay? Then you have a box like this. In that you have one football burr and a mandrel. Do you, all of you have that? Football burr and a mandrel. Okay? We will use the mandrel to do the finishing for the disc. So all of you have the discs there. In a plastic, you have all these discs of big and small diameter. So let us remove the discs and arrange it in terms of the grit. This is from a different company. It's from Germany. You might not get this here, but you can use any other disc, okay? The first disc is blue, coarse. Second disc is red, pink. Blue, pink. The third one is yellow and the fourth one is white. So it's like this: coarse, medium, fine, extra fine. Okay? Same thing with the smaller one. So please know the sequence of the disc along with the mandrel. Is it very clear? Apart from this, you have the main stuff. So you have 3 veneers, 1-1 small and 2-1 small. Can all of you see that? And you have 1-5 small, that is an overlay. Now please read, it is written very clearly, it is only for demo. It is not for human use. So I kindly request, please don't use this on the patient. It might work, but these are not laser sintered, so it might stain. The original product is laser sintered. Is it very clear? So please use this for practice, and if you are really convinced with this system, you want to use them, maybe you can contact Chaudhary. I think they will be getting this stuff very soon. Okay? So what I'm going to do is I'm going to remove tooth number 1-1 because I'm going to show you the demo. And this is the veneer. Wafer thin, excellent. You can remove it and feel it. Okay? And see the glaze. See the developmental depression, see the characteristics already there. Please check. Now what we will do, use these veneers for mock-up. For example, what I do is I quickly take some composite without etching or bonding. You just take a little bit of composite, roll the composite into a ball, okay, place that on the veneer, on the inner surface, like this. You see, that's my composite. And then I can directly go into my patient's tooth, place and show the patient for immediate mock-up. You see? So now patient sees and patient say, oh, this is how I look, okay, this is nice. Or she might say, no, this is not nice, whatever. Say for example, she denies the treatment, you don't have to worry. You remove this veneer back, you get rid of the composite and you autoclave it and use it for another patient. Is it very clear? So these are autoclavable. So I'm going to remove my composite. Okay. This is just to show you how you can use this in the other way. And then I'm going to clean the surface with alcohol swab. So please buy alcohol swabs. You always need them when you do adhesive dentistry. So I'm going to clean it. Okay, allow it to dry. And then I'm done. Okay. So now, say for example, I'm doing single veneer directly. So first thing, after selection of the size, I'm going to keep the veneer on the surface of the tooth and I'm going to check the gingival outline. For example, if the gingival outline is not matching, you see here it's slightly overextended, I'm going to trim that out. So you can do a lot of things. So for example, what I do is I take my disc, hold my veneer, can reduce it. See? Correct the form, can I get more triangular? I'm reducing, can you see? But use a very slow speed. If the proximals are out, you can hold it like this and you can correct the proximals as well. Okay, very easy, but never touch the incisal. Don't touch the incisal, only touch the proximals and the gingival. Okay, you will do this only if there is some discrepancy. If it is not, you will not do it. Okay, this looks good. Now my outline is pretty good, so I'm going to go with my procedure.
Reduce it labially.
Pardon?
Reduce it labially.
Huh?
Labially. Reduce by the proximal.
No. Labially you will not touch. It's polished. Please remember, labially don't touch. Only edges, cervical and proximal. Cervical and proximal, no incisal. I'm talking about the edges. Edges. Here. The edges. You got it or no? See, I am only reducing these. Cervical and proximal, that's it. No incisal, okay? So now I will place my Teflon tape because I am doing adhesive protocol. So please take your Teflon and isolate adjacent teeth. Okay, make sure the Teflon is pushed nicely not interfering with your tooth in question. And now, as usual, the tooth is prepped. You are going to etch with phosphoric acid for 20 seconds. Okay? Imagine I've done that. Now I'm going to use my normal adhesive, which I use on the tooth, not the veneer bond. This is the veneer bond. You see, this is the veneer bond which you will use for veneer. This is the adhesive which you will use on the tooth. So I'm going to first use my adhesive. So always use micro brush, and please stir your adhesive like this in the well and place your adhesive. That's my first coat. Then I go with my second coat. Okay? At this point I will air blow and then I will light cure. So light cure, 20 seconds from labial, 20 seconds from incisal. This is what, 5 second, huh? You don't have a 20-second mode in this? Which light is this? It's only one mode, huh? Okay. Now the tooth is ready. Okay, so I'm going to remove my Teflon. I don't need my Teflon. And now I again come back to the veneer. If I am working on a young patient, I can give characteristics from inside. So I will create mammalions, I will create line angles. So I will do all that now. So see here, slow speed micromotor, hold your veneer like this. I am working at the incisal edge because I want to give the mammalions. So see, now I give my lobes. Can all of you see the lobes?
Yeah.
Mammalions, yeah. Just give multiple lobes, okay? And then now I will give my line angle.
Always inside.
Inside. That will be seen. That's my line angle. Can all of you see? I'm going to do on the other side. So see the kind of characteristics I can do on my veneer from inside. I can also roughen it just to give more micromechanical reduction. I can give lobes, I can give Mehta. At no point it will break. It is so easy to use. Everything is done. But now since I created a lot of smear layer with my burr, I am going to etch the inner surface with phosphoric acid for 10 seconds. If I don't do all this, there is no need to etch. If I don't touch the internal surface, no need to etch. Okay? So now I'm going to use my dry brush, wash it. And now I will apply my veneer bond. So I'll take my veneer bond. See the difference between dentine bond and veneer bond. Can you see the color? The dentine bond will be yellowish always. The veneer bond is very clear, see? Very white. Because it's only hydrophobic, there is no hydrophilic component. So I'm going to apply my veneer bond, just a thin layer, on the inner surface of veneer. That's it. Air blow, and I'm going to light cure. Once you have light cured it, now if you want any staining, you can do that. So what I do is I have tints. You see, this is effect blue. Can all of you see this? It's called effect blue for translucency, and this is effect ice for white spot. You can use this with regular composites also, direct composites or any kind of work you do. So let me remove the blue a little bit. Can all of you see the blue? Now let me remove the effect ice. Can all of you see the white?
Yes.
Yeah. So now I'll take my instrument. I will place my blue because I want translucency. If I want type 1, you remember what is type 1? Proximal penetrating the mammalions onto the other proximal. So I'll place it like a type 1 around the lobes. So take very little on your thin instrument and see here, I'm going to go around the lobes. Proximal, around the lobes. That's enough. Play very little with the tints, otherwise it will become too much. So once this is done, you can also take a dry brush. Don't panic. If you feel it's too much, you can reduce it. Okay? You can remove it even before you cure. So now I will cure the blue. So blue is cured. Now if I want a little bit of halo or a white spot, I can do that. So how do I do that? Take your white tint. Maybe a little bit of spot here. Can all of you see that? Okay. And then I will take a little bit of white and I will create a nice little incisal halo at the incisal edge. Usually see young patients will have white pigment at the edge, if you have seen. That is called opalescence halo. So you can do that with your tint here. So now I take my dry brush, just a little bit, reduce it, yeah. See now, it's all nicely tinted and characterized. Now I'm going to cure this. So the color is decided not by this veneer, it is decided by the composite. So if I want high value, I will use A1, B1. If I want medium value, A2, B2. If I want low value, A3, A3.5, B3. Okay. So here we are using an A2 because I want a medium value. Okay. But if you want, say, a low value, you can use A3.5. Spectrum. So all of you will use this because I don't think we have gun. So you can use this. Okay. This is also quite good to handle. So if I am able to make a ball very easily, see, it's quite nice to handle. Okay. So same thing I'm going to do with my A2 composite. Whenever you pick composites in your fingers, gloved fingers, make sure you clean it with alcohol swab. Otherwise there will be a lot of contamination. Okay. See, now it's very clean. So here I go. See, these composites don't slump. You see, still standing tall, doesn't fall. Okay. So that's my composite. See? The moment, can you see the color inside?
Yes.
It's seen. So now what I do is I take my octapad and I layer histologically inside. Thick cervically, and as I'm coming down, I'm reducing the thickness. You see? Okay? Make sure there is no air bubble, no air voids, and make sure it's covering evenly all over. Now before you place this, there's one more thing. Please place your mylar matrix around the tooth now, like a U. Can all of you see? Like a U. And now what I do is I pick this veneer with my instrument like this, and I go and I place it on my patient's tooth. Okay? So just come slowly. Don't apply too much of pressure. Be very gentle. Press, 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 tap, tap, tap. Okay? And as you're tapping, you see, you will get a lot of excess. Push that excess inside. Push inside. Don't remove all the composite. Remove only what is remaining later. Okay? Push, 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 push. Take all this composite behind. This is the only time you will have a little bit of work. Okay? Push, push, push. If you are not able to manage this margins well, there will be a big problem. Same here. Push, 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 push. Take your Optra pad, merge it lingually. Okay. Don't cure until you are very happy with the final position. Keep watching. Don't cure, because there is every chance your veneer can go slightly like this or slightly like this. You might tilt the axial inclination. Don't do that. Okay. So I'm going to watch. I'm going to watch. Yeah. Looks good now. Push, push. Fold your mylar. Okay. Same here. Push, push. So when you are doing on the model, everything looks very good. But only when you start doing on the patient, you will realize what are the difficulties sometimes you might face. But otherwise, it's a no-brainer. Okay. So now I come in front of the patient. I see the position is good. I can take a BP blade to remove any excess I feel. See, when I'm moving, you see the veneer also moves. So just see how it has moved. Again, correct the position. Yeah, and then what I do is I only tap cure from the incisal. 3 seconds. That's it. Now the veneer will not move, no matter what. See, the veneer will not move. Now what I have to do is I have to remove all the excess, and whatever is deficient I can add now. So I keep pushing, see, still the composite is soft here. Can all of you see here? Still the composite is very soft, very soft. So see, if there is any gap you can add by taking a little bit of more composite, but if there is anything excess, I'm going to remove it immediately. See, it's easy. So my distal looks pretty good, but my mesial there is slight deficiency, so I'm going to add there. So this is the only thing which can happen. So I'm going to take a little bit of composite from my syringe and I'm going to add wherever you feel there is deficiency. Okay? Yeah. All the lingual excess I will remove, then I will use my disc and do it. So once I am very sure about it, I am going to cure fully. So now I am very sure about it, I am going to cure it fully. See how beautifully my veneer has come. Looks like a medium value. Okay? It's not very bright, not very dark. So now I'm going to cure it fully from all the sides. Now once you cure from all the sides, now what you require is to finish the margins. So I'm going to take my disc. First I'm going to finish my my lingual. So you can take a football and you can remove all the excess. So merge it. It's nicely merged in the lingual. Okay? And now you come on to the proximal. So for the proximal margins, don't use the football. You have to use the disc. I will always go with the second disc. Don't go with the first disc because it's very coarse. It will remove a lot of composite. So I'm going to go with the medium one, not the coarse one. And again, adjust the speed. If you find this is too much, I can reduce it. Yeah. So now you see how I work. I go along the margins. I only touch my margin. See it? Only touch the margin, don't touch the surface. You see now my margins looks nice and finished. Okay, so now my margins are nice and finished. If you want to give any characteristics, say you want to give depression or textures, you can do that and you can re-polish it. If I'm not wrong, you have two polishers. I forgot to mention that. These are from Kenda, it's from Germany. This is pre-polisher. The green one is pre-polisher, the grey one is post-polisher. To get the luster gloss, you will use the grey. Before getting the gloss, you will use the green pre-polisher. Okay, it works for ceramics as well. It's a ceramic polisher and a composite polisher. So you can use this on the patient, in your patients. If you are reducing the high point on ceramic, you can polish it back to get the glaze. So now what I'm going to do is just to show you a little bit of textures. So yeah, I usually use a red ring chamfer to give textures. See, this is from Mani. So I can give depression. So I can characterize all that. Again, micromotor. Suppose I want to give a little bit of depression here. I want to give a little bit of depression here. It is not necessary that you have to do this for every case, but if it's a very young patient and a lot of textures are there, you can actually see, you can give the depressions, you can give the lobes and you can repolish it. So I'm just showing you what are the possibilities. You can just finish your margins a little bit. Okay, and now once you are done with this, now my surface looks a little bit of rough. Can all of you see the textures I have created? Can you see the depressions now? it's more enhanced. But if I want to get the polish back, I will go with my green first and then grey. You will see the polish back. But only thing is, don't do it dry. Please keep putting water and do wet polishing. So I'm going to go. And here are the margins polished like this. Okay, that's my pre-polisher, and then finally I will use my glaze, the grey one, to get my luster. Okay, can you see the textures now?
Yes.
Yeah, see the surface, okay? It's very enhanced, huh? So now I will put water. And get my gloss. Can you see the gloss now? Can you see the shine? Yeah. Less than 10 seconds. Doesn't take much time, okay? Just work at the margins like this. If you polish, then it's not a problem. That's more than enough. See now. You can also see the textures. Yeah, you can see the gloss. The margins are really nice and subtle. That's my emergence profile. The lingual is fine. Of course, as I said, it comes with a big learning curve. You have to first do 2 or 3 cases, learn what's going wrong in your hands, and then you come to a situation where it's totally in your control. Okay? But an excellent system, especially for patients with abrasion, old patients, no aesthetic expectations, they just want relief from sensitivity and some reasonable aesthetics. It's a no prep. In erosion, abrasion, you don't have to prep. Roughen, etch, bond, take the size of the veneer, bond it, and you're done. Of course, I don't recommend this for every of your case, because not every case is the same. Are you getting my point? So this is exactly how the system works. After bonding, it's nothing to worry. If your bonding is good, it can take up any occlusal stress. If your bonding is not good, if your occlusion is not favorable, remember, even a zirconia can break. You know how zirconia is strong? So nothing can sustain if your occlusion is not favorable and if you have not tackled your bonding well. Okay?